This is Community Forum, a public affairs presentation of Mackenzie River Broadcasting. Each week, we learn about issues affecting our community with your host, Tracy Berry.
We've been hearing for months now about employment and staffing shortages across the country. Yet another impact of the pandemic that's affecting all types of businesses and organizations. That includes social service agencies, some of which assist some of our most vulnerable residents, children and teens. Across Lane County, the staffing shortages have affected inpatient treatment programs as well as outpatient, counseling, education, and other forms of support. This morning on Community Forum, we begin a two-part focus on how some local agencies are adapting while working to recruit new staff. We begin with Jasper Mountain, which provides a range of services to abused and emotionally disturbed children and, when possible, their families. Our guest is Executive Director Beau Garner. He says the challenges have been continuous and complex.
Yeah, for the past 20 months, our big focus was trying to keep COVID out of the program, which is a huge ordeal when you have 20 children living in one giant building together. So the stress of that alone was a huge toll on our management and our staff. But over the last 6-7 months, this ripple effect has occurred where, like a lot of places in America, we are experiencing a major shortage of staffing for our agency. And when it comes to a place like Jasper Mountain, our frontline staff, that's the lifeblood of what we do around here. And so without those staff in the building to take care of the kids, it's essentially equivalent to a hospital without nurses or doctors. You have a lot of very needy patients who need the skilled providers to be there. And we just have not seen the applications coming in the last 6-7 months.
And for folks who might not be familiar with Jasper Mountain, explain what it is you do, which helps explain why it is you can't just hire, someone from a general employment pool.
Right. So Jasper Mountain was founded in 1982. We are a psychiatric residential treatment center for young kids, one of only 4 agencies in the state of Oregon who serve kids under the age of 13 for that level of care. And basically what psychiatric residential treatment is the kids who have not been successful anywhere else. They can't maintain in a foster family. They have bounced around the system. Their mental health needs are so great that they need a specialized level of care, which again, we can offer here at Jasper, but that's after 37 years of training and experience and knowing how to work with those youth. So very specialized treatment in terms of what we do here with a very specialized vulnerable population.
So what sort of things do your staff members do when they're serving those kids? I mean, a lot of these children and teens, they're staying with you in a residential inpatient treatment setting.
Right. So our treatment model really revolves around trying to make this feel like a giant family setting. We don't want the kids to come in here and feel like they're in a hospital or institutional setting. We're out in the countryside. We utilize nature all around us all the time. The staff, their job is to show up and basically be parents to these children in terms of from waking them up in the morning, helping them get dressed, eat their breakfast, get down to our on-site school, modeling and providing that therapeutic interaction that the kids really need to learn and grow. So our frontline staff are basically parents to these kids who a lot of them have never had parents. And it's a very difficult job given their traumatic backgrounds, the kids.
And of course, your staff members then have to have some specialized skills, both in terms of education and clinical training.
Correct. We have been lucky over the years. We draw a lot from the University of Oregon and now Bushnell in terms of people who just got that undergraduate psych degree and don't know what to do with it. Typically, they'll come out to a place like Jasper Mountain and get that 3-4 years of frontline experience to really see what it's like to work in the mental health, behavioral health field. And so those staff, we want them to have that educational background degree. But when they show up, to be honest, we kind of say people aren't going to be as impactful or therapeutic with the kids for about a year. It takes a year of almost frontline training until they're going to be able to make a difference in those kids' lives. And so we really rely on those that core group of people who are coming right out of school, looking for that experience for a while and that extra training. And that's what we've really been lacking the last 6 months. We're just missing that group of people looking for that opportunity.
Must have been challenging because so many of the colleges and universities were in remote learning, so they didn't probably have the opportunity to do as robust a series of programs and experiences for their students as they hoped.
Correct. And even us, we normally go to in-person job fairs and have great relationships with the local universities, but that got severed with COVID as well. Everyone hunkered down. And so your kind of in-person connections with the universities and getting out there and recruiting, that really took a hit as well. But you're right. I think the world kind of froze for a while. And so, we're just now feeling some of those effects with people not really or being hesitant to kind of jump back into the workforce.
So how do you do recruiting in this sort of challenging climate then?
Yeah, we've had to be more creative. And so, we are a nonprofit on a very fixed budget, but our board of directors has basically said, we need to get creative with some of our funding and get out there. And so we have really expanded our online presence in terms of job applications, postings. A place like us, we always rely on word of mouth in terms of, hey, I found this great job, and go recruit your friend to come work here for a few years. So we've been doing a lot of the typical, but also we've hired some people in our HR department who basically their job is to try and go out and help recruit our frontline staff.
And from everything I've heard, you're not the only organization of this type in Lane County that's dealing with this sort of challenge.
That's correct. And in fact, it's statewide. I attend a lot of meetings with the other directors of child caring programs in the state of Oregon, and we are all facing the same situation. In a recent survey we all kind of took with each other in terms of the psychiatric beds that are offered for children in Oregon, between all of our programs, we are all running at about 50% capacity, strictly due to a lack of staffing. So you can see, the real fallout is the kids and the families who need this level of service. They are not being able to be served because the programs who provide it don't have the staff to meet that need.
I also have the sense the pandemic's really aggravated a lot of those situations in homes for families that are at risk.
Correct. I think that, as the pandemic hit, a lot of people who are in the child caring business, we were worried because honestly, the amount of calls that go into the child abuse hotline in the state of Oregon plummeted. And I think that was because kids were not in school, on sports teams, places where mandatory reporters had to lay eyes on children to watch for signs of abuse. And so we all knew that the abuse hadn't gone away. In fact, it probably got exacerbated with the stress of the pandemic. So I think that we're going to see over the next year or two some more fallout from kids who've been kind of stuck in tragic situations that weren't being tracked as closely as they had been prior to the pandemic.
That means that you've got to really focus on hiring and also plan ahead for a possible surge then.
Exactly. And, as our staffing numbers have decreased, our wait list for kids who need this level of service actually increased tremendously. And so that's even more frustrating that the need for our services is greater, but our ability to provide it has been diminished. The National Guard has been called in around the state of Oregon to help in hospitals. Well, child caring agencies sort of had the equivalent of that. We have 12 psych techs that FEMA called in from around the country that we had to train over a week's period. And now they are working frontline with our kids in the programs. And all the child caring agencies in Oregon are experiencing this. So there's actually FEMA level workers that have been called in to help kind of just shore up the staffing ratios because things have gotten so bad.
Well, that is a mental health emergency, I'm sure. Are these people from mostly across Oregon, or from where are they drawn?
Yeah, all over the country. In fact, when they showed up, we didn't have a single person from Oregon. A lot of people from Texas and Alabama and back east, and they basically have been deployed to our agency to undergo a boot camp style training in 1 week to then hit the ground running on our front lines. And so that's allowed us to actually kind of maintain some of our census numbers in our program. And without those people, we would have honestly had to cut back even further. So it was great that the state of Oregon recognized that and was able to call in those workers. And it did take a week or two, very stressful, to get them ready to be impactful with our kids. But we are currently functioning with 12 workers in our program right now who've been called in to help with this.
It's got to be a fascinating perspective from your end, but I suspect it's also fascinating for them to come to Oregon and sort of see what you're doing here on the ground.
Exactly. A lot of them, their background had been more in a hospital setting or working with elderly clients in residential care, and they didn't have experience with younger kids. So a lot of them has been very eye-opening. They're sitting there helping serve dinner and tie shoes and tucking kids in at night versus, I think doing blood pressure checks and handing people their medications. And so they had quite the learning curve. But honestly, a lot of them right now are saying, this is one of the best spots I've ever been deployed to. I love the kids, the relationships I'm building. So it's gone really well in terms of, I think, their experience of what we offer out here.
Well, perhaps they'd like to apply for some of your openings.
Get them to move to Oregon. That would be wonderful. Yeah, I think some of them might be thinking about it after building some relationships with the kids.
Is that a time ending type of commitment where FEMA's only funding through a certain date or something?
Correct. So the Oregon Health Authority is working with the federal level to kind of see how long we need these workers. And so every week we have to do multiple check-ins. Are we hiring people? Are we able to bolster our own numbers? How's the stability in our programs? So again, getting the word out, that we have job openings, and if people want to come work here, in the long run, that will help us free up the FEMA workers to kind of move on. But for now, I think the state of Oregon is hearing loud and clear that all agencies across Oregon still require this level of help to maintain what we're doing.
Can you give me a sense of the number of kids you're treating now versus the number on the wait list?
Yeah, I mean, right now at our Jasper Mountain campus, we have the capacity to have 20 kids in our residential building. The kids who come to our Jasper Mountain campus are very high end, and typical length of stay is 12 months of residential treatment. But our wait list right now is 40 plus kids who are waiting for that level of care to get into our program. And part of the fallout, not just at our level of care, but step down programs below us as well are struggling. And so that makes it difficult for us when we are actually ready to discharge a child. The services that we would normally hand them off to are also being impacted. And so that can just slow down the whole chain right there of, we have a kid ready to leave, but maybe there's not a community-based therapist or a specialized school setting for them to transition to. So you can see all over the place, it's turned into a backlog of kids and families needing services.
I suspect that's the same for the kids on the waiting list. They may be able to have access to some of those programs now, but only if they can find a slot with someone who's available.
Exactly. Yeah, there's a lot of families who call us daily for a checkup on the wait list. When can my child get those services? Things have deteriorated even further. It's you have to have a kind of veil over your heart sometimes in terms of dealing with some of the trauma and the stories that we hear working with these families. But, at the end of the day, we know our outcomes are good, and getting the families that we can really helps.
Yeah, and for your staff members, how are they adapting with it?
It's been difficult. I think even at the best of times, this is very challenging work. And so during the course of the pandemic, a lot of our staff have had to deal with their own COVID situations. Maybe they have their own family, their own kids that, they're stressed about at home, and then they come to Jasper Mountain and put all their energy into taking care of our kids. So we try to do a lot of things in terms of what we have control over, like supporting our staff, extra training, handing out thank yous, coffee cards, all those things that we can do to really let them know they are so important to the work we do around here. But yeah, it's been very challenging, stressful at work, stressful in the community, stressful in the world.
You mentioned the need for expanding staff and expanding support in the programs. If people want to contribute or help out in some way, there are ways to enhance the programs at Jasper Mountain. Talk about that.
Yeah, we actually, do welcome volunteers. We've had people from the universities or local businesses come out who want to, especially around Christmas time, hand out gifts, play the role of Santa. We've had other people show up who want to teach a music class or an art class. And so as COVID restrictions are somewhat lifting, we are more open to people coming to campus and again, volunteering their time to be with the kids. We also have people who are big monetary donors who love to support the cause and give to Jasper Mountain and what we do. And so we're always welcome to have conversations with those people in terms of, how can they support our program and give to what we do around here.
And companies and service organizations and the like, there's an opportunity for them to be involved too.
Exactly. We've had different groups show up who want to paint a building or build a porch or, hand out a bunch of bicycles to the kids. So there's all sorts of ways that people can give and donate and be part of what we do out here with the kids and families.
If people want to find out more, how can they do that?
Our website is a great place to start. And so you can visit jaspermountain.org and get some information there on what we do out here. It shows pictures of our beautiful campus and our buildings and some of the services we offer kids, as well as just calling our main telephone number and asking, to even talk to me and get involved and see what you can do with Jasper.
And that's Jasper Mountain, all one word, .org if they want more information.
Correct.
I keep thinking that with reduced services from Jasper Mountain, what does that mean for the community?
Yeah, the level of service we offer, again, is those kids who are very high end, who none of the lesser services have worked for. So without a place like Jasper Mountain, those kids are going to be dealing with law enforcement out in the community. Those kids are going to be ending up in the emergency departments sitting there because there's no other facilities or services to help them meet their needs. And so I think people forget that, young kids can have very big mental health issues. And if there's not specialized services for them, they can get lost in the system and put into situations that are more designed to deal with adults. And so a place like Jasper Mountain is very important to help provide that level of support for young kids.
And once again, you're hiring. You would love to hear from people who are interested in a range of jobs. Talk about that again, Beau.
Yeah, we would love to bolster our workforce right now. And I'm especially looking for those people who are fresh out of college, wondering what to do with those psych degrees, who are looking for 2-3 years of experience, frontline experience with the kids, as well as receiving a great deal of training for the different models that we use around here. Those people are what makes Jasper Mountain run and really helps the kids and families improve.
And people who've done it say it's a rewarding experience. It's a challenging experience, but a rewarding one.
Very much so. A lot of people like myself, I've been here for 20 years. And, I started as a frontline staff and became a therapist. And now for the last 2 years, I've been the executive director. And so for some people, you really find your passion and your calling, and you get involved and you want to make a difference in the world. In a place like Jasper, we have a lot of people walking around here who have been here for a long time because we feel really dedicated to the mission of serving these kids.
What is it for you that just made you say, this is where I'm going to stay and build my career?
Yeah, I think early on, it was a lot of the training and experience and understanding that I could make a difference. And then going along, just a lot of the personal connections with different clients in terms of providing to them hope that they've never had in other situations, and watching families literally have their lives turned around in a positive direction because of what we do around here. So getting up every day, it's exhausting knowing I'm coming to work and probably dealing with 5 or 6 different crises. But at the end of the day, getting that one phone call from a former resident or seeing that one kid feel success for the first time, that's what keeps us going around here.
Final thoughts or anything you want to add?
I think that, I just want to make sure people know we at Jasper Mountain are very appreciative of all the local community support we've experienced over the years. We've had a lot of donors and even people on our board of directors who have served for 25 plus years because they've come out here and gotten involved and really been dedicated to the mission. So if anyone else local in the community wants to know how they could get involved in helping at Jasper Mountain, either board of directors or volunteering or coming out and finding a job, we are more than welcome to do that. And we've been doing it for 38 years and would love the support.
Once again, that website is jaspermountain.org. That's jaspermountain, all one word, .org. Beau Garner, thanks for being our guest this morning on Community Forum.